of another global pandemic? Another lockdown? While it may seem hypothetical, the threat of the Mpox virus could make it a reality. The mere thought sends shivers down your spine, doesn't it? The stakes could be higher than ever, and the decisions we make now could determine our future. Stay with us as we uncover everything you need to know about the virus and how to protect yourself and your loved ones. First, let's talk about what Mpox is. The Mpox virus, also known as monkeypox, was first discovered in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name monkeypox. However, it's not exclusive to monkeys. It's actually a viral zoonotic disease, which means it can spread from animals to humans. In 2022, an outbreak occurred in Europe and spread globally, in which the disease was transmitted by touching virus-contaminated materials or between humans, mainly through sexual contact, although this type of transmission is not the most common form of transmission. In recent months, monkeypox has seen a resurgence, particularly in Africa. Since the beginning of 2024, the Democratic Republic of the Congo, DRC, has experienced a severe outbreak, reporting over 14,000 cases and 511 deaths. This outbreak has been driven by a strain of the virus that is more deadly than the one responsible for the global Mpox outbreak in 2022. Additionally, new Mpox cases have been confirmed in several other African countries, including Burundi, Kenya, Rwanda, and Uganda. These outbreaks have prompted the World Health Organization, WHO.
The situation constitutes a public health emergency of international concern.
And the Africa Centers for Disease Control and Prevention.
This is not just an African issue. Mpox is a global threat, and it is in this moment of vulnerability.
The spread of the disease has been rapid, with genetic sequencing identifying the strain as Clade 1b. Globally, Mpox transmission continues at lower levels outside Africa, but the resurgence in Africa, particularly in the DRC, has been of significant concern. The WHO has been monitoring the situation closely, and as of June 2024, 934 new cases were reported from 26 countries worldwide. The CDC has stated that the recent rise in cases has prompted us to increase our surveillance and public health measures. These developments highlight the importance of staying informed and vigilant as the situation evolves. Now, let's talk about the symptoms and how to diagnose Mpox. Mpox symptoms usually appear 6-13 days, up to 21 days after infection. Early symptoms can be quite general, including fever, headache, muscle aches, and exhaustion. What sets Mpox apart is the development of a distinctive rash, usually starting on the face and then spreading to other parts of the body. Within 3 days of experiencing the initial symptoms, the rash may spread quickly and eventually turns into small fluid-filled sacs known as vesicles. If the rash spreads throughout the body, it can also affect the palms of the hands and the soles of the feet. Most people experience mild to moderate symptoms that usually last 2 to 4 weeks, followed by a full recovery. Supportive care may facilitate recovery and reduce the risk for permanent lesions. For example, scars on the skin. Diagnosing Mpox involves laboratory tests and clinical assessments. Doctors look for the characteristic rash and other symptoms, and they may take samples to test for the virus. The severity of the disease can vary depending on several factors, including how the virus is transmitted, how susceptible the person is to the virus, and how much of the virus a person is exposed to. Complications of Mpox in areas where it is most common include encephalitis, related bacterial skin infections, dehydration, conjunctivitis, inflammation of the cornea, pneumonia, long-term effects such as disfiguring scars, and permanent corneal lesions. The mortality rate of Mpox ranges from 0 to 11% in outbreaks, with young children being the most affected. Immunocompromised individuals are at a higher risk of severe disease, and HIV-positive patients may experience more severe symptoms. Prevention is always better than cure. Here are some practical tips to avoid Mpox infection. First, maintain good hygiene practices like regular hand washing with soap and water. Avoid contact with animals that could harbor the virus, especially in regions where Mpox is known to occur. Handling food and animal products safely is also important. Make sure meat is thoroughly cooked and avoid consuming products from potentially infected animals. Vaccination is another critical tool. Vaccines are available and have been shown to be effective in preventing Mpox. UNICEF emphasizes that vaccination is a critical tool in preventing the spread of Mpox, especially in vulnerable populations. If you're in a high-risk area or profession, consider getting vaccinated. General protective recommendations include: 1. Isolate yourself in your room and do not share household items with other members of the family. 2. Avoid contact with immunocompromised persons and other persons at risk for severe disease until the rash heals completely. 3. You can temporarily leave your home, but you should wear a medical face mask and make sure to cover the rash before going out. 4. Maintain good respiratory and hand hygiene and wear a face mask when in contact with other people. 5. Abstain from sexual activity until the rash heals completely. To wrap up, remember these key points. Know the symptoms of Mpox, take preventive measures seriously, and act quickly if you suspect an infection. Awareness and prevention are our best tools against Mpox. As the World Health Organization says, together we can combat the spread of Mpox through vigilance, knowledge, and action. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more updates on health topics. See you in the next video.